The type of treatment explored in this study is called melodic intonation therapy, or MIT. MIT involves the facilitation of regular speech functions using melodies or a sing song quality to the voice. Patients are prompted to speak words or phrases, but instead of speaking normally, they are instructed to sing them. People with nonfluent aphasia are usually able to sing despite their impaired fluency and word finding difficulties, which makes them perfect candidates for MIT. This treatment interests me in particular because I always thought that singing would be a more complex language skill. However, I learned throughout this course and throughout this assignment that singing is dominantly controlled in the right hemisphere, and this would explain why those affected with a left hemisphere stroke would still be able to sing. The article sought to prove the benefits of MIT early on in the recovery of patients with nonfluent aphasia. It was hypothesized that there would be a greater positive change in expressive language ability in the post-test of patients who underwent MIT compared to those who didn't. The researchers used a randomized controlled single blind design in which 30 acute stroke survivors diagnosed with varied severities of nonfluent aphasia were randomly assigned to either receive MIT or not. The pre and post tests were based off of the Western Aphasia Battery, and the pre-test was conducted in order to determine the severity of each patient's aphasia and included a responsiveness and repetition section. A music therapist administered MIT to the treatment group. In the first session, patients were taught to sing a single phrase, and then an additional phrase was then taught at each session. The researchers concluded that speech output improved significantly after one session of MIT, which confirmed their original hypothesis. Both groups, whether they received MIT or not, improved from their pretest scores. However, the control group only showed signs of improvement in repetition skills, whereas those in the treatment group improved in both repetition and responsiveness. And the researchers also claimed that those in the treatment group showed signs of a carryover effect in which their right hemispheres helped to facilitate impaired speech processes in their left hemispheres. One of the weaknesses I noticed while reading this was that perhaps it would be more beneficial to use a mixed design ANOVA instead of a single blind sample because the researchers wanted to test the difference between two independent groups. On the other hand, a strength was the consistency with which the researchers conducted the participants. For example, there were only 39 in the study, but 30 at the end because they wanted to make sure that each patient was physically able to complete the pre and post test for accurate results. This study proved the positive effects caused by MIT on expressive language capabilities in nonfluent aphasia. By singing, MIT can assist in the use of right hemisphere functions that cross over and help facilitate impaired functions in the left hemisphere. In fluent aphasia, although the prosody isn't impaired like in nonfluent aphasia, I wonder if the relaxed melodies taught in MIT could help to slow down some of the torrent of random words that come out without their control in fluent aphasia. Perhaps MIT can improve repetition skills and awareness in fluent aphasia as well. Thank you.